This is She's on Call, a weekly show hosted by ENT specialist Dr. Sujana Chandrasekhar and General Surgeon Dr. Marina Kurian. They'll be joined by guest experts to discuss an array of newsworthy medical and health issues. You're invited to ask the doctors anything. The physicians and their guests' views are their own and do not represent any institution. Please contact your doctor for any personal questions. Please hit share and join us live on Facebook, Twitter, and YouTube at She's on Call, hashtag She's on Call. Please welcome our hosts.
Hello, I'm Dr. Sujana Chandrasekhar. I'm an ear, nose, and throat surgeon in New York City and New Jersey. And for today's show, I want to let you know I have a very special interest in the dizziness aspects of traumatic brain injury. How do you like that, Marina?
Me up. You're okay. I'm Dr. Marina Kurian. I'm a general surgeon here in New York City. I do weight loss surgery and minimal invasive surgery as well. And I'm clearly a Giants fan because I got my colors out. I just couldn't find any jerseys, and all I have are fleece. But I will tell you guys this, that my blue Doug is sharing my Giants love, even though. So why are we in football here, Suju?
I'm all Cowboys all the time. I got my sparkly football earrings on. I got my Emmitt Smith jersey on. Today is Super Bowl Sunday. And here in the U.S., we are going to see Tom Brady, quarterback for the Tampa Bay Buccaneers, who will not only be the oldest quarterback to start in the Super Bowl for, I think, the third time, but in fact, today will be the oldest player in the Super Bowl at the ripe old age of 43. Do you remember 43, Marina? I was pretty young at 43.
And I wasn't feeling any pain at 43, but what football players put their bodies through, I'm sure he has some pain. And then, of course, Patrick Mahomes, who's just been an amazing force in football. And he's 25. He's playing for the Kansas City Chiefs. Going to be very interesting. But I'll say one thing. As a New Yorker, we've never been a fan of Tom Brady. I'm just going to say it. And the Patriots, right? And mainly because of the Patriots fans. They can be very aggressive. But the point is here, it was never Belichick. Right, people? Anyone, all the things, Belichick's such a great coach, blah, blah, blah. Look what he's done with the Patriots. It was always Tom Brady.
Well, Brady and Gronk, I have to say, whether you like him or not, Brady is a GOAT. He is one of the greatest of all times. Sonny Slaughter just wrote in that she loves Emmitt Smith and always wanted to be Sonny Smith. And I'm like, Sonny, I would have scratched you down the aisle to become Sujana Smith. Really, I love Emmett. We have two amazing guests today. We have Dr. Robin West, who is an orthopedic surgeon. She is the first and only woman head team physician in both the NFL for 18 years and the MLB. This is her sixth season. And Dr. Ian McNeill is a neurosurgeon with a special expertise in spine surgery. He played football for Harvard and hails from a major league sports family. And we are very excited to bring them on in a few minutes.
Yeah, specifically with our little tie-in for Super Bowl Sunday, because, we are friends. So, but first, some news of the week. We're going to pop up this past week. Wednesday was National Women Physicians Day. Yeah. And this is my favorite meme of it. It was never just a dress, okay? Just like the one there that always looks like it's like a Wonder Woman cape. But this is, this is a great meme.
35% of women in the United States are women. So happy with National Women Physicians Day, Marina.
Yeah, thank you. So we're going to go to, sadly, more COVID news. We're just going to run through some of the things and talk about the vaccine. I personally am having a hard time getting my staff to get it. And I went through and I took it. My nurse practitioner took it, and then some of my staff I'm still pushing. They push back and they don't want to do it. And meanwhile, they have access. It's actually calamitous in my mind.
Well, it has been a year since the first case of COVID-19 was diagnosed in the U.S. After the first and second peak, we hit a really high third peak that started in about September of 2020. Gratefully, that trend line is consistently going down now, but we have had over 26.6 million deaths and 4 million cases and 450,000 deaths in the US. Both those lines are going down, but we know that there are super spreader events like please don't go to a Super Bowl party, just eat your chicken wings at home alone. But you know, Marina, the numbers are hard to wrap your head around, right? I mean, it's really hard to think of what that number of 2,000 or 3,000 dead people per day means.
It's bad, Suju. It's like we don't want to wrap around, but at least it's better than we were over 4,500 a day. So I mean, I think this is better. I want to pop up the slide on the COVID-19 vaccines. I think this is what it shows you that we've 60 million in the U.S. Okay, that were distributed. 40 million is probably a little higher right now because we're doing a little bit better than 1 million a day, and so. That's great for the US. And look at worldwide, though. It's 128 million. And then Sujana really tried so hard to find out how many were administered in Africa. They have a huge population. And it's less than 20,000. But it might be slightly more. But you can see that there's a horrible discrepancy of what's happening. And go ahead, Sujana.
Yeah, and I think this is, we are seeing that the vaccines rollout has been sort of wonky. We definitely know people are having a lot of trouble getting vaccines all over the world, all over the United States. People are, it's like, like we said last time, it's like trying to get concert tickets. You keep having to go online, and you can't assume that especially older people or people without means have such access to those systems. The disparity among in COVID has really brought out race issues in the United States. So we know that it affects people of color much worse. And we also know that vaccines are not getting to people of color at the same rate. So we have this kind of confusing looking graph, but it's clear if you look at it for a second. If you look at this, the sort of yellow dots are the share of people who are vaccinated who are Black. And the black dots are healthcare workers who are Black, and the blue dots are the population who's Black. And if you just look at the first two, Mississippi has 38% of healthcare workers and 38% of the population is Black, but only 14% of people who are vaccinated are Black. And if you look at Maryland, the numbers are 30% of residents are Black, 42 or 43% of healthcare workers are Black, but again, only 15% of people who are vaccinated are Black. And we're seeing that across the country. In New York City, they set up vaccination centers in like Harlem, which is a predominantly Black neighborhood, and we saw more white people coming for their vaccines there. So I think there's a lot of work to be done. I believe that the Biden administration announced that they were going to partner with local and chain pharmacies to try to get the vaccines out to more people.
And, I had the privilege of talking to Dr. McDougall, who's the president of the National Medical Association, and there's a lot of thought going into how to get our minority communities involved and willing to take the vaccine. And so there's a lot of partnering that's going on with the religious communities in these areas, and maybe getting buses out there. But the other important thing is our NFL teams, they're going to all use their arenas in the areas that they have them to help vaccination. So that was just announced, as you told me. But now we're going to get to our guests. We're so excited to have them. It's our football segue. So if you want to introduce them again.
Sure. We're very, very excited. Are you ready for some football talk? We have Dr. Ian McNeill, who is a neurosurgeon specializing in spine surgery. He's currently at the University of California at San Francisco. He used to play for Harvard University. He was a walk-on football player for them in his undergraduate years, and he comes from a family of incredible sports players. We have Dr. Robin West, who is an orthopedic surgeon. She is the president of Innova's musculoskeletal service line in Northern Virginia and the Washington, D.C. area. She has been the first and only woman head team physician in both the NFL and the MLB, with 18 years in the NFL with the Steelers and the Washington football team, and now her 6th season with the Washington Nationals. So welcome, Ian and Robin.
Thanks for having us. Great to be here.
Yeah, so it's so exciting to have both of you here. But the thing about, we all love football. I'm a horrible fan in terms of I'm screaming at the TV like they hear me. I will run down my hallway if I see them get the ball. I'm like, go, go, go. And I'm running down like I'm running down. It's insanity. And thankfully my family puts up with me. But there are really horrific moments when your heart just stops when you're watching a game because there's an injury, and you're holding your breath. And Dr. West, Robin, you've been involved in those situations, and you had a player actually that had a horrific injury on the field, and we have an image of some of the screenshots that were grabbed when Alex Smith had a horrible we call it tib-fib, right? Tibia and fibular fracture that was basically compound. Can you explain what happened here to our viewers and listeners?
Yeah. So back on November 18th, 2018, he sustained this injury. It was an open tibia fracture. So a compound fracture means an open tibia fracture, meaning the bone was sticking out of the skin. And so that happened, and we took him off the field and, diagnosed that injury quickly. You can see from that imaging that he had this very complex fracture. It extended from his ankle all the way up to his knee. He was taken to the operating room emergently. We got him in the operating room within a 2-hour window and washed his wound out and fixed his fracture. And unfortunately, he had an infection, a significant infection, within about a 24-hour period following that surgery. And so from that point, he wound up having 17 surgeries. And the reason he had to go back so many times is he had a necrotizing fasciitis. So he had a bacteria. Necrotizing fasciitis is what we hear when we talk about this flesh-eating bacteria, right? So it starts to travel up the leg quickly. So within those first couple of days, he almost lost his leg and almost lost his life. And I'm lucky I have some great partners here. And so I got the trauma orthopedic surgeons involved, as well as plastic surgeons, and he got the care that he needed. So we had to do muscle transfers, a gastrocnemius a rotational flap, a vastus lateralis free flap, fix the fracture, and obviously get rid of the infection. So it was a long road for him. And last night he won the NFL Comeback Player of the Year. So he made a miraculous recovery, all because of him.
I'll tell you, a lot of people on Twitter were saying it should be called the Alex Smith Award. Like it's such an amazing comeback. It's one thing to come back from one surgery or 2 or 3, but to 17 of them. And I think you were telling Nora O'Donnell, so if I wanted to marry Emmitt Smith, my husband wants to marry Nora O'Donnell, and just letting you know, just putting it out there. But you were telling her on 60 Minutes that was the first time you had actually gone onto the field to take care of Alex when he had that, oh my God, you couldn't even look at the videotape of that fracture. Can you talk to us about that? And then I was really impressed about your commitment to working with physical therapy and prosthesis manufacturing and titanium to work out the brace that he's actually using as he's playing in the NFL in this season that's ending today.
Yeah, so I go on the field a lot for every game. I'm on there several times a game. But Alex was someone who hadn't gotten injured yet. He had just come to our team that year. He was traded from the Kansas City Chiefs to us. And so it was his first season with us, and I had not run on the field for him. So that was my first time going out with him. And obviously it was a devastating injury. And so from that point on, obviously we got to know each other very well. My role really, I feel like as a head team physician is to build a team around me and to collaborate. We have to work together. It's certainly not just, I'm not the only person involved in the care of the athletes. It's our primary care physicians, it's our athletic trainers, our physical therapists, strength and conditioning coaches, neuropsychologists. There's a whole team, and to get everyone involved. So from that moment, when Alex got injured, within those first couple of days, as we're taking him back to the operating room every day to wash his wound out, to debride the muscle and the skin, I reached out to a friend of mine, Johnny Owens from Center for the Intrepid. And Johnny deals with these warriors, who come back and are either going through a limb salvage where their limb is being saved or with an amputation and fitting them for prostheses. So I reached out to Johnny after speaking with Alex's wife and saying, are you okay if I reach out to Johnny? Because we may ultimately need his services. We're going to need his services one way or another. We're going to either save Alex's leg or we're going to have to amputate. And so I reached out to Johnny and he said, when Alex is ready, let's start working with him. And so that injury was in November. And I think it was early February, we went to Center for the Intrepid. We got to work with Dr. Alderetti there, who runs a trauma. He's an orthopedic, oncological, and trauma surgeon. And we got to work with him and really start to develop Alex's rehab and his plan for return to life and then ultimately return to football.
I love what you said about how you're really building the team around this, but your empathy, sympathy, and just realizing who to reach out to really made a difference. And one of our viewers, Jared Cooper, just said, Dr. West, she should be commended as much for her bedside manner with the Alex Smith family as for her medical prowess. You kept their hearts and minds in the game during the worst of times. I mean, that is so true and so wonderful that you were able to be there and help him.
Thank you.
So you guys who are watching, you certainly can tweet at us or send us any messages on Facebook, because we are live on Facebook, YouTube, and Twitter. And we're also played on WBAI on Mondays at 2 o'clock, which is 99.5 or WBAI.org. But we want to switch gears a little bit and pull Ian in. Dr. McNeill is a spine fellow at UCSF and also a neurosurgeon. And so we wanted to ask you, you have a history of playing the game, and you played football since you were very young. Talk to us about just showing up at a university. Well, talk to us about your experience in football, and then also how you just show up at Harvard and walk on the field.
Yeah, sure. So the way I would describe it, in the McNeill family, sports just exists in the blood. If you walk into our household at my parents' house at any time, you'll see still, even though it's an empty nest, you'll still see sports on the TV. It's always on the background every holiday. And I'm the oldest of 4 siblings, all of which played youth sports. My 2 sisters played collegiately. One of my sisters also played professionally, is now the head coach of women's soccer at Brown University. So from an early age, our parents never forced us into sports. It was almost the default. I remember playing both youth basketball and then soccer. And then once 5th grade rolled around, Pop Warner football became an option. My father at the time used to always do morning jogs, and I joined him. And he always took a break at the cul-de-sac. And I asked him, what position do you think I'll play? And he told me, I think it'll be a running back. And it was written. And from then on, football just became part of my life. And which really, I've looked back so fondly upon the game. Played through Pop Warner, through middle school, joined the high school football team, had a great career, was recruited by other Division I schools, but ultimately I got into Harvard. I had sent my tape and recruiting film to Harvard, but they said they didn't need another short, fast running back. They already had one. So it ultimately got in. And the way walking on works is, the spring camp or preseason camp starts before school actually starts. And so for those people interested in walking on, you arrive, you enroll like other students, and then you go down to the football office and express your interest. They had a pretty rudimentary tryout, and a couple of us were invited to join the team. And from there, players are very accepting. It's not easy being the walk-on, being the last guy trying to catch up, learn the system, learn the plays. But had a great time playing at Harvard. Still look fondly back on those years. Developed a lot of great relationships with the teammates. So it was a great experience.
There's a lot to be said for what you guys go through with that team approach, right? In athletics. I'm a mental athlete, not really athletic. So, but I love working with colleagues that have been huge athletes in their past or been on teams all their lives, because I think that building that team approach, it's something that carries through not just in medicine, but into corporate America as well. It's something that's so well served, and it helps kind of guide and quiet your mind, right? Because you have a strategy as a teammate. Yeah,
I think the team-oriented nature of medicine is so important. And I always think it's kind of interesting that we train people to, be, heads down, studying for tests, studying for standardized tests. But really, at the end of the day, your ability to communicate and work within a team is almost preeminent about all these other factors. Obviously, you need the knowledge, but I think some of the best physicians are those that communicate well and work well with the team. And I think those are some of the values that you learn in all sports. I think football is particularly special because there's so many players in every team. And I think it's unique in that football can be appropriate for any type of athlete. So you can have short and overweight athletes. You can have tall and lanky athletes. You can kind of be the loner who are, typically the kickers, so to speak. So there's really a role for everyone. If you think about your typical high school team, literally anybody can show up and be a part of that team and find a place. And that's why I think football is so special. And then we like to talk about the Tom Brady's, the Patrick Mahomes, the quarterbacks or other skill positions often get the glory. But when you think about every single play in football, every person on that 11-man field, 11 people on each side, has a specific role, a specific duty they have to carry out. And if one person falters, the whole play can become a disaster. And I think that kind of, as I think about my career as a surgeon, that often that plays into how we operate in the operating room as well. So as surgeons, we are often, the quarterbacks or the captains, but we need the nurse, anesthesia, the scrub tech, even SPD to carry out their role to clean the instruments. And if any one of those roles falters, the patient suffers. So I love to think about, football being, everyone shares that same mission, but at the same way, everybody in the OR shares that same mission to help the patient.
I think that's a terrific way to look at it. I think, when you bring those skill sets to the team and you actually act like a team player, we certainly find that the buy-in from everyone is better. I just want to remind our listeners and our viewers that we are live on Facebook, YouTube, and Twitter. We are actually closed captioned on YouTube, and we are carried on WBAI 99.5 FM on Mondays from 2 to 3 p.m. or WBAI.org. I want to shift gears to, as we are in fact talking remotely, the four of us, because it is the time of the COVID-19 pandemic. We've had some really good questions come in from some of our viewers. So Nina Yashbe says, have all the players in the NFL and the NCAA been vaccinated? Can they be people that we can look to help motivate others to get their vaccines? And just to follow up with that, Bob Glazer, who runs actually my practice, which is over 200 physician practice in New York, New Jersey area, says that he's seeing some hesitance with front desk staff, mostly women, worried about vaccines and infertility. So maybe, Robin, you can talk to some of this with your mostly doctor, somewhat NFL hat on.
Yeah, so in the NFL, the players have not gotten vaccinated yet. And also in Major League Baseball, they haven't either. And the interesting thing, you were talking about the discrepancy in race and vaccinations. And I think that's what I'm seeing in the NFL as well. And I thought a lot, put a lot of thought into it and why that's happening. And is it the availability of the vaccine? Is it the ease of it? But I think it's actually more education. I think that the people I'm finding who are not wanting to get the vaccine maybe don't have an understanding of it. So to me, I feel like our role as physicians is to get out there and to have people understand what the vaccine's about, what it can do to help us, how it can help our country and help everybody else. So I find that with the players, I'm trying to talk to the players and educate them around it, because there is certainly a lot of anxiety. I can tell you probably just from polling our players on our team, probably less than 30% want the vaccine.
That's a really shocking statistic. I think, Ian, there's a question from Keval Ramanathan. How many professional or semi-pro athletes do you think hide the degree of injury? Because even in club baseball, people hide the fact that they're injured or maybe got clocked with a ball yesterday so that they could play.
Yeah, I think playing through pain or discomfort comes part and parcel with any highly motivated athlete. I think one of the issues is that, especially as you get to elite levels, elite college athletics, professional athletes, or semi-pro athletes, if you take a day off or take a game off, you are concerned about losing your spot on the team. And when you're incentive and, when you're a young person, you're not always making the most rational decisions that we would as, older adults. So the motivation there is to keep your spot. And if you can play through discomfort or pain, I know I done it in my career. In fact, I tore 3 ligaments in my knee, partial tears in my ligament in the knee. I knew something in the spring game of my junior year. I knew something was wrong with my knee, but I continued to try to play in the second half of the game. And once I came out, my knee swelled up like a watermelon. So I think it definitely happens. I can't estimate the percentage, but especially at these elite levels, particularly likely in the NFL, and Dr. West can speak to this, you have players that are nursing injuries year round just to get through the season, get to the game so that they can continue to play, keep their spot on the team. And in the professional level, this comes down to continue to being able to make a living. So it definitely is an issue. But I think that playing through discomfort or pain, injury is something we've seen in all athletics, not just football.
Dr. West, what are your thoughts on this? I mean, it's a great point. And I've seen, how many times have you seen a huddle on the side where there's injections given and things like that in the past? I'm sure not when you've been on the field, but you wonder, how are these people getting back in the game when they just look like, shaken up and just not their 100%.
Yeah, so I certainly people play through pain, and it's very common. And again, if the contracts aren't guaranteed, then they potentially can lose their spot if they're injured. So there is some pressure to play. I think that's changed dramatically since I started 18 years ago. Again, it's around education and educating the players, especially around head injuries. And so players are much more willing to come to me now and tell me about a concern or if they're not feeling right. The injections, I always get asked questions about the injections. We do injections for games, but the injections are done for minor injuries, something that is not a risk for them to play with, but maybe they have a little pain. Maybe it's an AC joint injury where there's a little bit of an irritation of the joint. We can do a little local injection to help them with pain. But again, I'll never let them play if they're compromised. And so those are questions that often are asked.
Robin, I'm sorry. Can you tell us what an AC joint is?
A acromioclavicular joint. So it's the end of your clavicle, and it's a very common injury. And so that's something people always say, I saw you run back in the locker room and then I saw your quarterback come back out and play. And, so we will do oftentimes a very small little local injection like that. But again, not using narcotics or anything to play, but just something to take away a little bit of that superficial pain.
What do you guys think about, there's actually a little bit of a parallel, right, between, players being wise to not continue to play, and then all of us in healthcare who are like, now I know I'm not alone. We all used to go in when we were sick, right? Now we're like, well, yeah, we probably shouldn't go in. That's bad. Don't go in if you're sick. There's that parallel, and this COVID-19 and coronavirus has really pointed out that our how much what we do when we're feeling unwell really can impact not just others, but our own future. So there's been an incredible parallel there.
Yeah, I think that education is for the players too, because if somebody's playing right compromised, they're putting themselves at risk. They're also putting their teammates at risk. If they can't make a block for something, or then the other teammate's going to potentially be injured. So there are a lot, and as Ian said, it's a team approach. So they have to work together.
Did Ian, did you have, and also Robin, please tell me about this, but I've looked at some of these new companies that come out with these tech helmets for football. Did you have a special helmet, Ian, when you were playing? And there's some companies out there right now, like Vices is one, and that they're supposed to help distribute the blows so that it's not a single force. Maybe we could talk about coup and contra coup injury too, but let's start with the helmets.
Yeah. So when I played from 1998 to 2002. Really played before where there was a lot of focus on head impact exposure, the risk of developing of CTE. So I played with, what we call your old school Riddell helmets. The technology of helmets has evolved a lot, and a lot of the studies that have come out regarding head impact exposure have included actually internal telemetry units, which are basically accelerometers placed within the helmet between the pads to help study the head impact exposure of football players. So the technology is continually involved. I did not personally play with those helmets, but the helmet technology continues to evolve.
So, Ian, we've talked about COVID. We've talked about sort of musculoskeletal injuries. A paper came out this week in JAMA, the Journal of the American Medical Association Neurology, talking about the fact that NCAA or collegiate athletes have much higher rate of concussion or TBI, which is traumatic brain injury, during practices and even in the preseason than during games. Can you talk to us about that? We send our kids off to college not to get clocked in the head, but to get an education and maybe to enjoy playing some sports. So can you talk to us a bit about that and what needs to be done?
Sure. The interesting thing, there was a New York Times article as well as the JAMA Neurology article. The interesting thing, the data around head impact exposure in practice is not new. So the embedding of accelerometers to kind of study head impact exposure started in the early 2000s. And between 2005 and 2010, there were studies that came out that suggested that most of head injury impact exposure and vulnerability to concussions actually happens in practice. And so with that data, that kind of led to the NFL limiting contact in practice during the regular season. The Ivy League football conference actually eliminated contact in practices throughout the regular season. Pop Warner football has limited contact practices. And then there are 40 states across the country that have put in regulations regarding head impact exposure by limiting contact in practices. However, the NCAA kind of lives in this regulatory no man's land. We have 18-year-olds who are technically adults, but there's no ability for them to organize and put pressure on the overall body. The analogous body would perhaps be the NFL Players Association, who can regulate and put pressure on the NFL to adopt practices to protect them. But the NCAA players do not have such protections. So in any case, this data shows that despite what we know about head impact exposure for college athletes, some of the guidelines put in place have not changed. And so overall, 72% of concussions still occurred in practice, and actually 50% of concussions occurred in the preseason. So this kind of is a blistering revelation here that we have not made much progress in protecting the brains of college athletes. And so there still needs to be stronger guidelines and higher degrees of accountability to protect these college football players.
And it's not just football, right? I mean, there was a study that came out before looking at soccer players and women's soccer players, and that there's something, and I might be misremembering this, but that their heads I don't know, the women's heads are not supposed to be able to sustain as much a force of hitting the ball with their head, something like that, or whether it was the sheer force. I don't remember exactly, but there was a really high rate of concussions and unrecognized concussions in women's soccer players. You guys remember that?
I think they're definitely, so football, I think, gets a lot of the attention because of the attention the NFL has garnered over the years. You know, when CTE started getting more attention, it was through the discovery of CTE in a retired football player who had suffered from the syndrome of CTE, and more players have come to light with this similar syndrome. But the risk of head injury exists in many sports: lacrosse, ice hockey, soccer. So it's definitely not football alone. It can be any sport that poses a risk of head impact exposure. And pragmatically, that makes sense. I mean, if you think about it, there's a reason we were designed and evolved to have a skull protecting our brain. We're not meant to be running and hitting things with our head. And we're not meant to have other objects hit our head either. But sometimes it happens in the sport. So we have to do a better job of thinking about protecting our players in all sports.
You know, Robin, Dr. Anthony Fauci says he still wants to throw out another first ball at the Washington Nationals game. So I wonder if you're going to duck before you get clocked by his ball.
That's right. The women's soccer study, I just wanted to tell you earlier. So I remember that some of the study was also around the neck musculature, on hormonal changes, same kind of things we see on ACL tears and why they're higher prevalence in women. So just.
Yeah, there's also, that's right, that the other separate study looked at how much injuries that the women are getting in soccer, and there was a high rate of the ACL, as you said. Mm-hmm. Right. This is all interesting to me. I don't know why. My daughter was playing, and she's constantly complaining about injuries, and I'm like, I don't know, maybe you shouldn't play.
No, let her play, please.
Yeah, so she's playing, but it's still kind of scary. There are some lawsuits coming out looking at concussions and what is the thought process around that and what's actually happening?
Yeah, these recent lawsuits are coming out now. Two former NFL players have put a lawsuit out against the concussion settlement. There was an NFL concussion settlement back, I think, in 2013. Mm-hmm. And so these NFL players, what they can do is, if they have post-concussive symptoms, they can come forward and get an evaluation by a neuropsychologist. And then that neuropsychologist can submit that report to get payment from that concussion settlement. But what's happened, and it seems that only about a third of the players coming forward are getting paid out. And so now they're starting to look at why that is. And is there some racial profiling going on, or it's called race norming. And so what's been happening is these neuropsychological tests have norms. They do this normative data, and they basically use race, age, and education when they look at the neuropsychological scoring. And so it's interesting because I work closely with our neuropsychologist, and she really believes that education and age should really be considered on the normative value. Race often is for other variables, for other reasons, because of an education status. When you look at education, you look at how far did they go in school, but you don't look at, was there a history of ADHD? Did they have to have help getting through school? Did they have tutoring to get them, all the way through? Is there a history of drug use? And so instead of sort of breaking it down into these other variables, it's kind of popped into, it's put into race. And so this lawsuit is now looking at that, because these players have come forward. Neuropsychological testing shows that they meet the criteria to get the payment. And then the NFL's come back and said, wait, the normative values weren't considered. So once the normative values then get considered, these players no longer meet the criteria.
Well, that sounds crappy. There was an article about 10 or 12 years ago looking at who got insurance payouts when they were hurt on the field, right? There's a fund, I can't remember the name of it, and there was one guy who was running it, and there were players that were crippled and in pain, and that there were GoFundMe accounts or benevolent donors who were supporting these players, and meanwhile they were sitting on a pot of money, but they couldn't actually get access to it. And it was this whole expose. I believe it was in Sports Illustrated, but it could have also been in like Maxim or is GQ still around? The pandemic has taken me away from all that. I don't know. But that's just a crime. And I'm glad that that's really being looked at and they pursued it.
As we go to a very difficult discussion about CTE, or chronic traumatic encephalopathy, which is chronic injury to the brain. Ian, your dad's cousin was Fred McNeill, who played for UCLA and then played with the Minnesota Vikings for 12 seasons. And he then went on to become an attorney. Unfortunately, he was the first living person diagnosed with CTE based on some of the functional neuroimaging that we see here. Can you tell us what this is showing and what we learned from these unfortunate cases?
Yeah, so Fred was a football player. In our family, he was known for being one of the most gregarious, nice, energetic people you could ever meet. So beyond his accolades on the field, he was just a tremendous person as well. In terms of, and you described the story well, he was a tremendous football player, also brilliant man, started studying for law school while he was a football player, and actually was eventually promoted to a partner in his law firm, but saw his career derailed due to the syndrome of CTE and ultimately succumbed to ALS. But in terms of, typically CTE traditionally has been diagnosed on autopsy. So looking at the brains of dead football players. But in this was the first case in which they were able to use functional MRI, which looks at the different areas of different blood flow in areas of the brain. And they were able to see decreased blood flow in some of the subcortical regions, suggestive of a pattern of CTE. I think there's still a lot of research being done using fMRI and then also using serum biomarkers to see if some with new technology to see if we're able to detect detect CTE before the presence of the syndrome and obviously before autopsy.
Is there any correlation between CTE and ALS, or it just happened in his instance?
I don't think there have been a number of cases to establish a correlation. When you look at a lot of these autopsy studies, there are overlaps. So in addition to CTE, you may have other types of dementia. So there are can be signs of Alzheimer's disease as well as CTE. And then, of course, there are players that have developed the combination, but there haven't been enough players to establish a correlation between CTE and ALS. But there definitely have been overlap of other neurodegenerative disorders along with CTE.
Chris Ramanathan had a quote also. I know, and we see Sunny Slaughter's here, but I want to pull up Chris's because he asked, and Dr. West, you can speak about this. He asked, are there anything that the players are doing or that you're instructing your players to do to help promote their long-term health? Because we all know there's a recent thing about Tom Brady, right? He spends like a lot of money in the off season to preserve and promote his health.
Yeah, there are so many things. The thing that we always focus on is that injury diagnosis, right? Not covering up your injuries, getting your injuries treated, because we have so many ways to treat them. And then also on the injury prevention, how can we prevent injuries? And so there are so many things that we do during the off season, as far as conditioning, as even from ocular training, from vision training, because by working on vision training, you can decrease your risk of injury. So we do a big focus off season on a variety of things. And then the recovery side, and that's the NFL's move more towards giving players recovery days. So post-game, post-contact practice, and having time to recover. And there are all kinds of things that we can do on the recovery side. And the holistic approaches too, all the natural kind of anti-inflammatories, fish oils and turmeric and healthy eating and nutrition, the psychological aspect, working with our sports psychologists. So those all play a big role. So again, it's this very broad, comprehensive program.
You know, the NFL and other major league teams, major league programs have really sort of led the way in testing and tracing and isolation during the COVID-19 pandemic. And the CDC just released the NFL data from August to November of 2020. Can you talk to us a bit, Robin, Dr. West, about what the NFL did to keep players safe and so that the season could go on even with fewer people in the stadiums? And then I just want to say, Ellen Austin, who's one of our viewers, said, wait a minute, are the players eligible for vaccinations? They're not over 65. And I think that we are trying to educate all of our patients of all ages so that when their turn comes around, they will know the benefits of taking vaccines. But I wonder, Robin, if you have a different take on that.
I agree. I agree that education is key. So we should educate everybody. So everyone's waiting in line, right? They are not eligible currently, obviously by CDC guidelines, but I like to continue to educate them. So when it's their turn, then they can make that choice. So yeah, the NFL did a really phenomenal job. I remember starting the season and thinking this is never going to last. I had just finished baseball season where we had a lot of struggles in baseball. Yeah. And so when football started, we're doing the same thing that baseball was doing, the daily testing, masks, the 6 feet apart. So following a lot of that and temperature checks. But we were successful. And I think what we found as the season went on was that there were 3 things that really led to higher risk. It was the eating, greeting, and meeting. So we always eat together when we're traveling. And so by limiting that contact and not eating together. So now as the season went on, we wound up getting our meals and going to our room and not eating together. That was one way we did it. Greeting. And so just hanging out socially, right? So going to someone's room out when you're traveling and sitting in their hotel room with very low ventilation. That was another source of it. And then meeting in a room. And so all meetings became virtual as the season went on and there were no in-person meetings. And we did we did contact tracing. We wore we were tracing devices. So whenever we were around each other, we were traced. So every day I'd look at my tracing and you could see, okay, she was around 50 people, this person for 2 minutes, that person for 5 minutes. So you could see how much time you spent with people. But what we found, unlike the CDC said, their guidelines are to stay 6 feet apart. And if you had contact for more than 15 minutes with one person in a 24-hour period, that was considered high risk. But we actually found that it was less time and maybe more distance. And again, it was all linked back to that eating, greeting, and meeting. It came down to ventilation. It came down to masks. It came down to time spent with someone and distance. So by keeping everything outside, practicing outside, separating the guys out for lockers and showering and everything was timed. So no one was really around each other. And that's how it worked.
And then we see that you guys did a ton of tests. I mean, 623,000 yes. PCR tests.
My nose was sore at the end of the season. We got tested every day. And so
we PCR tested every day.
Yeah. So the players were tested every day. And as physicians, we were initially tested every day for the first part of the season. Then we went to every other day, and depending when we were going to be around the players. But it wasn't actually the testing that helped us. We look back at what it was, and it was really, again, just the tracing and contact tracing and seeing how we spent time with people. And where we spent time with them. Was it in a ventilated area? Was it outdoors? Was it indoors? And what was our proximity to them? And so those contact tracers are what really helped us.
I know that you guys follow the football news. And earlier this week, the barber for the Kansas City Chiefs tested positive in the middle of a haircut. Like he was literally pulled off the second haircut of I think 20 people, including Mahomes and all the starters, were on the line for a haircut. And I guess he was double masked and the players were masked. And I think the players who were exposed were tested for 5 days and are cleared to play today. But, that's something that, the rest of us like to go for a haircut once in a while. Like what kind of maybe not you so much, Ian, but what kind of precautions should we be concerned about?
It's the same thing. It's masking, even after getting immunized, everyone says, okay, I'm immunized. Like I can go out and be free. No, we have to continue with our social distancing and masking until we get this herd immunity. And so I think by following that, again, we had the luxury of testing everyone. Anyone we were around, they were tested daily. So I don't know the whole story exactly with that barber, but I'm sure he was tested the day before and was probably negative. And that morning he probably got tested, and that probably came back positive. So but again, if he was masked and wasn't around the players for too long and they were in a ventilated area, that may be a lower risk.
Yeah, the tracing, as Sunny Slaughter just pointed out in one of the tweets, is so critical. But let's shift gears here a little bit. I want to talk about, you guys' journey to where you are. Like, right? It's hard enough to, get into med school, right? And then graduate, get into your fellowship, your programs, like to get into ortho, especially Robin, as a woman, getting into ortho back when you got in. I'm not making any age assumptions. I'm just saying that. And, for Ian as well, to get into neurosurgery, so tough. I think neurosurgery is harder to get into than ortho, and the spots are less. Okay, let's start with Ian. Why don't we just talk a little bit about your journey so our listeners can kind of understand, and then add to that, I'll tell a quick story that I'm sure the listeners are sick of hearing. When I was a resident, they told me, guess what, Marina? Guess who the worst surgeons are? And I was like, what? There was a study that came out, right? Left-handed female surgeons. I'm like, forget the brown part, right? Like it just was, that's it. And I wasn't the worst surgeon. So anyway, I just pointed out the fallacy of the study. But Ian, let's hear from you first, and then and Robin.
Sure. Yeah, so I was always interested in the human body early from in high school and college, primarily from a sports performance and understanding how the muscles and kinesiology, kind of just learning about it on my own. I was pre-med at Harvard, but actually majored in Afro-American studies because I realized at the time I'd much rather read and write about a topic I was passionate about and do pre-med studies on the side. So ultimately, I graduated from Harvard, Afro-American Studies major. I went to, and from there, I kind of have a circuitous route back to medical school. I did 2 years of in-home intervention with at-risk children with severe psychiatric diagnoses at the Yale Child Study Center. And during my time there, I applied to medical school. Actually didn't get in the first time. And so I did a special master's program at Georgetown, but ultimately discovered that, I spent all my time in the library studying, and I was like, there has to be more to life out there. And so I actually sought a job out with a healthcare consulting firm, kind of seeing if working at changing healthcare from a macro perspective would be more interesting. Ultimately, spent 5 years with that healthcare consulting firm, learned a lot, but ultimately I missed that one-on-one connection with people. And so reapplied to medical school and landed at the University of Virginia. And actually, in my first year, I thought I was going to be an orthopedic surgeon, especially because of, my first entree to actually experiencing healthcare was with an orthopedic surgeon, given my knee injury. But ultimately got involved with the neurosurgery research study. And ultimately what sealed the deal for me was actually going to a clinic with one of the neurosurgeons and meeting patients that were close to my age and actually having to undergo the prospect of a brain surgery. And realizing that they were dealing with a life-changing, life-altering moments. And as a neurosurgeon, you get to be a counselor and help them through what can be a very difficult moment. And you really get to deal with the humanity of a patient when they come to you seeking help with a neurologic disorder, whether it's from the brain or the spine. They're reaching for help to help you get back to their identity. And so fell in love with
Ian, that is so beautiful. I just want people to reflect on what you just said, because man, oh man, you don't equate neurosurgeons with talking about the humanity and the soul. And I'm really taken aback.
It's so harsh, did you?
I work with neurosurgeons all the time, and we're working in the thick of the body, but to remember about the soul is really very, very beautiful. We had put up a slide about the paucity of Black men in medicine in particular. Can you talk to us about patients seeing someone who perhaps looks like them for the first time?
Yeah, so one of the great things about working or training in New York is the tremendous amount of diversity there. And Mount Sinai was located at the top of the Upper East Side and the very bottom of Harlem. And in East Harlem is actually the highest concentration of public housing in New York City. And so we had a very diverse patient population. I remember several occasions coming into patient rooms who were Black, and they were kind of taken aback, surprised that their surgeon was a Black man. And a number of patients, after examining and talking to them, would often say, "Oh, I'm so proud to see a successful Black man, being, doing their thing." And there are a couple of patients that immediately I was able to establish a rapport with patients who otherwise felt marginalized or mistreated by the healthcare system. But being able to walk in the door, put them at ease, I think makes a difference. And I think that speaks to the importance of having a diverse workforce within healthcare at all levels. And so Black men in medicine has been a particular area of interest of my own, because actually the number of matriculants in med school between 1978 and 2014 actually declined. And so at Sinai, during my time there, we started a mentorship program called Dr. Men, Doctors Reaching Minority Males Exploring Neuroscience. It's still in place. We're actually working on publishing our manuscript describing the success of the program, but definitely still an area that needs attention.
Ian, thank you so much for that. Dr. West, please tell us, because I'll tell you, I remember working with female orthopod residents when I was a resident, and they had it tough. How did you get through? And then how about winning over the players? It's not just your colleagues. They see how you work, and, like putting a dislocation back in, they would always talk about the knee being the worst. So you don't have the strength to do it. And I'm like, you're probably right. I don't, but that girl, she does, and she's going to get it done.
It's not about strength. It's about finesse, right? It's all finesse, right?
Yeah.
So there are only 4% females in orthopedics when I went into it, and even less so in the sports field. And in the NFL, there are only there's only one other female orthopedic surgeon. So it's a very low number. But I think that the what drew me to orthopedics and sports medicine was, again, sort of what Ian said. Ian said he works for the mind and the soul, and I work for getting people back to what they love doing. So active people of all ages and abilities, getting them back to what they want to do, whether it's walking, golfing, playing football. And so that's what I'm passionate about. And then as far as, being a woman, I always get asked that, being a female in a highly male dominated field. Sure, I've had my challenges as an orthopedic surgeon, but as a team physician, I actually find that the male players come to see me and probably seek me out more than they do my male counterparts. Many of especially on the football side, many of them have been raised by single moms and single grandmothers, and they have a lot of respect for women. And so I've had the opposite feeling, really, as what people are surprised by that, I think. So I have not really had an issue at all.
That's really wonderful. And also, because you've done such a great job, but, we've had people who were the first in their field before, but they said they would always just wish there were more people coming in, so that they don't have to be the first anymore. I don't know if you're experiencing that, Robin.
Yeah, sure. You look at, as I'm sure we all were, we were trained by these old school surgeons, and you guys went through the same training I did, right? And you're not strong enough, you're not that, go get pregnant, get out of the operating room, all the standard stuff. But so it's always nice to have somebody, a role model or someone to look up to. I certainly have a lot of male role models though as well.
Yeah, and I think Marina and I have actually talked about this quite a bit on the show, that we are very beholden to our mentors and our sponsors of both genders and all races. The amazing thing today at the Super Bowl will be that there are going to be 6 powerful women on the field, on the sidelines, as coaches, and in fact, the first downs judge, who is a woman, Sarah Thomas, will be there. What do you see when you look at this, Robin?
I think it's great. You know, again, when I started, there were three of us total. There was one female athletic trainer, and there was Leanne Curl, who's the orthopedic surgeon for the Ravens, and myself. And so those are the only women we ever saw in the stadium on the field. And so it's great to see this, and I think that the players are happy about it as well.
All right, you guys, we're so excited. It is Super Bowl Sunday. It's a big deal, you know, but it's going to be a quiet big deal, I think, for everybody, which is okay. And the screaming will only be heard by my neighbors because I live in an apartment. So I want to thank you both so much again, Dr. Robin West and Dr. Ian McNeill. Thank you so much for joining us. You guys, it's been fantastic. Next week, it's Valentine's Day, but Suju and I will be here, and we're going to have some relationship experts on. I want to thank our team. And without them, we couldn't put the show together. And you can see who are our producers and for the video highlights and design. And then, you know, we'll be back next week.
Have a great Super Bowl Sunday, everybody. Stay safe.